Dr. Lisa Goins, nurse practitioner with Couture Healthcare, and today's lab day. Well, what does that mean for you? It means a lot of work for us, but for you, it's going to be some simple things that you're going to do for me, like peeing in a cup. And when I need you to pee in a cup, what I'm going to have you do is I'm going to give you a little packet, and we're going to tear this open, and you're going to open this up. And it's going to be hard, and if you don't have any nails, it might be a little bit. But you're going to take this packet when you're in the bathroom, and you're going to wipe over your peri area. This is the front to the back motion that you're going to do. This here cleans the area, takes off any bacteria that is in the area that would make the urine coming out contaminated. So we want a clean specimen for the cup. Okay, so you're going to take this, you're going to wipe front to back, and don't throw this in the toilet because it'll clog it up, so throw it into a can. That would be nice. There'll be a little container there. Alright, then the next thing I need you to do is take this, and then you're going to have little graduates on the side, and you don't have to top it off, but give me a good amount of urine, and then you can put the cup, the top on if you want, or you can leave it off depending on the facility that you're at. But you can also take a piece of paper and put over it and set it aside. Now what will happen is the person that's going to take the sample is going to check the temperature of the urine to make sure it is urine, it isn't Mountain Dew. And they're going to also check the pH level to see if it's high or low. They're going to check the gravitational amount of the urine, and they're also going to check to see if there's any bacteria in here or a high white blood count, which will tell me if there's some other problems going on. And it'll check you for nitrates and some other odds and ends. Now this cup is for urine for a bladder infection type. Now you may be given a different type of cup that is for a drug test. Now drug tests are done differently than urine tests. Drug tests have to have the water shut off, colored dye put into the toilet to make sure that this is really what it is. Now unfortunately sometimes it is very embarrassing for women when it's that time of month to give a sample because the blood will show up in the urine. If you do a correct front wipe, hopefully that will minimize it. Please do not be embarrassed. It happens, it's part of life, it's a body function. And it will just tell us that yes, there is blood in the urine, but it will not stop us from finding out if there's some other problems. So don't feel bad about that and don't feel ashamed, okay? And then we will take this cup after it's processed with the name and everything on it, and we will fill out one of these handy dandy papers that says this is urinary, and we'll send it off for our culture, and we'll put it in one of our bags. So it'll go in the cute little back here. This is the stuff that we get to do. And then we open this up, and as you can see sometimes it's not easy, and we'll stick this in here, and with along some other odds and ends, some samples and things. Sometimes we'll send it like this, sometimes we will send it in a special tube. It just depends on who's processing your lab work. And then it'll go into one of these little nice containers, and everybody wants to see what's inside of these. Ah, there it is. Okay, and then it will go in here, and then it will be picked up by the lab personnel. Now, as you can see here, there's no drugs or money in here. So if you think that you would like to steal one of these little boxes, surprise, you're going to have some body fluids. Ugh. So if you do, bring it back. And we'll appreciate that if you don't take our white boxes. And I'm Dr. Lisa Goins from Couture Healthcare, covering lab work today. Thank you for watching. If you like this video, please like, share, subscribe, or you can leave a comment at the bottom of our YouTube channel. Thank you.